is the 9th of January, 91, and that makes us in this building something over 50 years, Ancel. How did we get in this funny place?
Oh, this was, the real question was to provide space for the Starvation Study. Yeah. And at that time, Frank McCormick was a good friend of mine. He was one of the guinea pigs, you know.
He was the athletic director, too?
Yes, he was the director of athletics here. And when it appeared that we were going to do something like this, the question was where to do it. Yeah. And he said, well, we can do something over the stadium. I didn't know anything about the stadium at that time. The office at that time was in Millard Hall. Mm. So I was pleased to move out of Millard Hall for various reasons. And also...
which we'll not record for history.
No. Which also involved a lot of work here, really getting things organized.
Sure.
But here we were for a long time, and to some extent still are here.
Still here. What did you pay for getting over here? Did you have to teach the Phi-Ed students, or did they just give us this pitch?
No, they didn't pay anything at all. And those are the good old days when, well, money was scarce and we didn't have any, so we didn't use any. No, I don't think we paid for anything.
I think we taught physiology to the Phi-Ed students for 20 or 30 years. So
no, I taught physiology for the medical school.
Okay.
And I recall moving up from the Mayo Clinic. I was glad to get back in an atmosphere that was a little more academic than down there. But it did involve giving something over 50 lectures in the physiology course. And the total was something in the order of 120, 130 lectures, and I gave 50 of them. And I understand now it's what, 15 or something like that.
Excellent, yeah.
But that was the usual thing in those days.
And so there was a lot of collaboration between the government and universities during the war that stimulated much of what's gone on since. You had a lot of activities going on here.
Well, it started, you know, when Margaret and I were in Mexico City doing some work on heart size in children. And the war broke out. We had a little difficulty in getting transportation back to the States. And as soon as I got back here, I had an urgent message from the War Department. And they wanted me to do something on diet. I didn't know, having no idea why they did that, but the net result was that I was appointed a special assistant to the Secretary of War. And out of that, many things grew, including the fact that their first requirement, first wish, was to get a parachute ration. And Colonel Isker and I went down to a local grocery store and bought stuff, put it in paper bags, and carried out a trial at Fort Snelling on a platoon of soldiers. And that seemed to go well. And then we were told we should have a bigger trial, and so we went down to Fort Benning with a full company of soldiers. And there, the chief of infantry was looking on. I forget his name, General something or other. And he thought this was just fine. He said, let's have it for all the infantry. Not merely.
Well, that's where the K ration became unpopular, when it was used.
Certainly was used.
Not for short-term survival, but
we found evidence that it was used for months out in the South Pacific, things like that. But
well, you housed a number of people here later, didn't you? Quartermaster people and the conscientious objectors, right in this room and around the
yes. Well, the next thing after that was because I was concerned. There was evidence coming all around at the end of the war would see a lot of problems, and people had been semi-starved, especially in northern countries. So I went to the Surgeon General's office and mentioned this and said, we ought to get some evidence on this. And
what happens when people are starved and then refed?
The net result is that I, being an experimentalist, proposed we carry out an experiment. And we got the authorization to have conscientious objectives, and then we came to the point of where would we put them.
Where did you put them?
And that's why we came over here to the stadium.
Where did you put them?
Upstairs.
Upstairs in the gym?
Yes.
They had bunks up there?
Yes. They had. We had a total of about 50 men up there, 40 conscientious objectors and some others that were involved in keeping track with them.
And then you exercised them on our treadmill down here. You fed them in the kitchen here.
Yeah,
This went on for how many weeks?
This went on, the controlled dietary part went on for nearly a year. There were 6 months of the very low diet. And the net result of all that was that we got through, we had an enormous amount of data, and that was finally published, as you know.
Biology of Human Starvation. That really started...
Two volumes.
Yeah, that started things moving. You moved from there to looking at other changes in human biology as a result of interventions on physical activity, on diet, and that opened a whole new area.
And yes, of course, at that time the emphasis was on the dietary side, but at that same time, the end of the war, there were a lot of cases being reported in the newspapers of prominent executives dropping dead. And that seemed to me that here was something that nobody seemed to know anything about, but there were so many of them. Why wouldn't it be possible to set up a prospective study? And that was done with some difficulty, but anyway, the cooperation of all departments of the university practically and of the Chamber of Commerce and downtown put us in touch with the leaders, and here they came.
We'll walk around a little later and show folks where you did all the examinations on those people. But you brought about 300 of these executives of all the leading companies in Minnesota, all the deans here, the governor, Luther Youngdahl, and others, into this building for extensive exams.
Year after year, we went on for, for nearly 40 years, examinations every year. And some of them, of course, had moved out, but they came back. The Governor Youngdahl, whom we had advised to do something about his hypertension, took a judgeship in Washington, but he came back here every year until he died. So
how did we start moving out from here? Those were very important experiments in human biology. How did we start moving out from the laboratory into the wider community and around the world? You began to be thinking in terms of sick populations as well as sick and healthy
my
people.
feeling was this, that executives are not necessarily a good example of people.
Okay.
And it appeared to me that it would be very well to look into other population samples, and the opportunity arose when I went abroad for various things to look into the question of doing studies on different populations, samples in different populations. So that was...
Who were your colleagues in all these nefarious activities?
Oh, this began in a very peculiar way. There was a conference or convention of the sort in Naples, and of the people there were several who were interested in this, and we began with one of the doctors who had worked with me here, Flaminio Pedanza.
Nutritionist.
Yes, he was in nutrition. And so the idea then was to see whether we could do a survey international survey. The survey was conducted at a little town called Nicotera in southern Italy, where I felt it was important to get someplace where people were not moving away all the time, would be fairly stable. And that was a stable population, we found. Many interesting things about it, including the fact that the mortality records were a little odd. We found that they recorded in the previous year that there were 6 men died of lead poisoning. I thought this is a little odd.
That was Sicilian lead, was it?
And this was lead in bullets. You know?
Sicilian lead.
And so that was...
But you brought a lot of these people over here, and they studied with you for some time in this room, in this building. And then they went back, and they were your principal collaborators in Japan and Greece.
Yes, I think right in this room, Noboru Kimura from Japan came here with a suitcase full of postmortem records.
From Japan.
Almost 10,000. And he says, help me do something with it. I said, I don't know anything about this. But we worked for about a week, and that's the way he came into it.
He demonstrated that the fatty arteries were quite different in Japan than here.
That was one of the things. You didn't have as good information as we thought you should have. And there again, the question of making a survey, and from the survey came the continuation, the prospective studies, and they're still going on.
Well, tell us about life around the lab here. How did the day go? I understand it focused around tea time in the early days.
Well,
in fact, I played a part in that.
That's right. I wouldn't say it focused on that, but I think a very important part was getting together and knowing one another better during a period of an hour in the afternoon in this room for tea. And I don't know when that stopped, but it went on for a long time. And you had some experience with that, of course.
Yeah, I dropped in about 1953 and kept coming until now. And that was pleasant. And the faculty would be as large as 8 or as small as 3. And the staff would be as small as 12 or as large as 30.
Yes, when I left, Henry,
we all knew each other.
That's right. When I left and you took over, I think the total number was 40. And now, what is it, 10 times that, I suppose, at last count. It changes.
Bigger, not necessarily better. But we were all working on very similar or related activities, and we met socially a great deal.
Yes, the beginning of thought on all these things, I think, in my mind anyway, was that we should be able to find things that would relate eventually to prevention. And the focus, of course, began with coronary heart disease. That was the thing that was in the newspapers, and that controlled our interest for a good many years. But as time went on, I and some others felt that this was a little bit too limited. Some people didn't die of coronary heart disease, they died of other causes. And so that has been the situation now, that we have in the follow-up of more than 12,000 men in 7 countries who have been followed for more than 25 years, and all of the men in 30 years for, I think, half of those men. And of course, the job of keeping track of all that stuff has involved your participation here, Alessandro Menotti in Rome, who finally took over the job of coordinating the reports from the different areas.
Rose Hilk and John Bellandri here were very centrally involved.
Well, they came in a good deal later, actually. But as you say, there were a lot of people, a lot of doctors who came here and worked for a time and carried, what you might say, carried the torch back. Rafael Carmena from Spain, he's a highly important doctor in Spain now. Many others. So many people have gone a year or so here and have gone out to do great things elsewhere.
Well, when we had the first Ancel Keys lecture in Dallas last fall that Jeffrey Rose gave, I had a slide of all the people that had been through the lab. And it reads like part of a who's who of cardiovascular disease. It was fun. Who were some of your colleagues locally we haven't talked much about? The Taylors and Grandis and Andersons and Brojeks and...
Well, they were, of course, absolutely essential to all the work that was done here for many years. And when you came in, which is quite a while ago, very early on, I think we had a remarkable team, which, as I say, was the locus of the interests of a lot of people who were influenced by the example here. Some of them did remarkable things, like Rafael Carmena was here for a little over a year, and then he was down to the local hospital for some time. Recently in Spain, he has become one of the leading internists in the country, and his charm is such that he was able to persuade Carmelite nuns to be participants in a dietary study. And that's incomprehensible.
And then Paco Grande, the other Spaniard that was with you for years and is now back running Spain.
Yes, Paco Grande came here mainly because the big shots in Madrid were not approving of some of his ideas. Grande had some liberal ideas at that time, And he saw that his future was clouded, so when an opportunity came to come here, he came here and stayed for 20 or 25 years.
And went back when Franco was on his deathbed, as I recall,
that's right.
and has done very well since.
That's right.
Well, that was a remarkable thing. You had biochemists, you had physiologists, you had physicians, you had electrocardiographers, you had psychologists, psychiatrists, and they would all bring their views to your issues. And that
they brought the
tradition
tools of their trade to a common endeavor. Really, that's what it amounted to. And well, as the years have gone by, and of course, too many of them are no longer here. You mentioned electrocardiography. Ernst Simonsen was a great man in electrocardiography, and I had nothing to do with it because I didn't understand it. I occasionally have questions about work of that sort, and I refer those questions to you and to the memory of Simonsen.
Well, Simonsen was, of course, a German Jewish immigrant just before the war, and when I arrived in '53, he was having difficulty communicating with the medical fellows. They didn't understand his accent. I just arrived from 3 years in Germany. I just took to him, speaking my broken German and his English. He brought me down here within a week after I'd been here. So I was exposed to the lab in '53, that's 37 years ago. And Ernst carried on in his area of work physiology and electrocardiography for many years. Got a grant, as I recall, a new grant 2 weeks before he died.
Oh, really? But you know, actually, his experience was a little perhaps like that of one or two of the other people. He moved from Germany to Russia. He was devoted to the idea, had some sense to it, that Marxism was something to think about, at least. And he was, after a while, disillusioned. He was very happy to get out, and to have the opportunity to come here was wonderful. And here he blossomed.
And Brozek, another immigrant, Czechoslovakia.
He had the same kind of experience. He accepted the job after he got out, his doctorate. The only job that he could get right off was in the shoe factory. And what he was supposed to do in the shoe factory, he wasn't sure, but apparently they wanted advice on how to fit shoes, size of feet, and things like that. And so he became interested in anthropology on that score. But he, again, very close call when the war broke out. He escaped and went to Italy, and from Italy here.
Well, all these people were a team for a number of years on the issue of the effect of diet on blood cholesterol levels, and you operated that here and out of here. What were some of those adventures?
Well, I suppose we should begin by saying something about the experience in 1952 when Margaret and I were making surveys in Naples and then in Madrid, and it was seemed to me quite clear that there was some relationship between the diet and the incidence of coronary heart disease. Rich people had different diets and different cholesterol levels, which Margaret was measuring, and they had the only heart attacks in town. That was true in Naples and also in Madrid. So when those findings were written up and delivered at a big meeting in Amsterdam, some people were impressed, and a great many people didn't believe anything about it. Mm-hmm. But that was the beginning, I think, of conviction that I had, and followed by many others, that the diet was enormously important. The only trouble with about surveys, of course, is that you really can't know anything without the kind of control that would come by an experiment. And so the idea then was to have experiments. Fortunately, a friend of mine, Ralph Rosen, had been appointed as the director of the Hastings State Hospital. And I talked to him about this, and he says, well, we can provide things down at Hastings. And so he did provide things in the way of a whole building, locked building, which housed, I think, a maximum of 40 schizophrenics, burnt-out schizophrenics, as they were called. And there, for 8 years, dietary experiments were carried out with primarily the Joseph Brozek being interested, but Joe Anderson was the man on the spot.
Right.
So this, I think, showed beyond any doubt that there was a very close relationship between the diet and the dietary fats. First, we thought all fats. Later on, we felt we should distinguish between the diets and the serum cholesterol level. So that seemed to identify a whole field of work that should be carried out in the field to populations. That was a wonderful opportunity, a sort of thing that could not be done nowadays. Impossible.
Why?
Well, because in the first place, you don't have mental hospitals, which long ago, when I was a boy, they used to call them insane asylums. Mm-hmm. But mental hospitals and that kind don't exist anymore, and it would be impossible to carry out any kind of an experiment of that sort. Actually, of course, I'm sure all agreed that we did the patients a lot of good. They had been neglected, and interest by anybody shown to them helped their psyche. They were burned out schizophrenics, but they had some emotions left.
Yeah. Well, the legal concept now is informed consent, and the idea is that people that are incarcerated, either in such a hospital or in a prison, can't give freely informed consent. Yeah. But in terms of the mores of your time, it was highly ethical research, and it was public research. Occasionally, Ancel, I still get calls from reporters who have been investigating Tuskegee or some World War II research and say, we hear there was secret research going on under the stadium on starving people and conscientious objectors. Can we come out and talk about it? So I say, sure, come out. And they think they've got a scoop, and then I open up these scrapbooks and show them July 14th issue of 1945 of Life magazine with these men portrayed, and they go away with their tail between their legs. It was not secret, but as you say, we couldn't do it.
And the sort of thing that was done then, for various reasons, couldn't be done now, which is a pity. Other examinations and so forth, prospective studies on the diet at least were carried out, but without much success. But the best one was in South Africa, when the study was made for 2 years on both black and white prisoners. And
Cape Coloreds also,
yes,
the third group.
Yes, there were almost equal number of these. And from there came the data quite clearly showing, confirming us, that the dietary response, the response to the diet in serum cholesterol took 3 or 4 weeks, and then it was stable. That, on the other hand, for triglycerides, it took at least 6 months and generally a year. And I think that lesson is forgotten. I see many reports now talking about triglyceride in a way that seems to me that they have never realized that triglycerides do not stabilize for a long time. I also have have much doubt as whether triglycerides are of much help in looking at the problem of even of coronary heart disease.
Well, they tell us a little bit about what the metabolic or the eating pattern or the drinking pattern is, but they don't predict. Well, all this was culminated, all this 10 years work or so on experiments in diet and cholesterol, in something that's known as the Keyes equation. This was just a straightforward regression that you applied to the data.
Well, here we had several variables and how to look at them, and I think in my primitive way, I thought the thing to do was to do a multi-regression analysis and put in the variables we knew about, and I think the net result is known the world over ever since.
Yep. That issue is pretty well settled. One of your pioneer colleagues that you adopted along the way at Harvard was Henry Taylor, whose primary interest was energy output rather than energy input. And,
physical activity, yes.
Yeah, and he and I developed a laboratory railroad car and went around and examined railroad men that you're still studying today. Tell us a little bit about how Henry got involved in this.
Henry was, when I was teaching at Harvard, the system there was to assign a few of the bright seniors as to talk with somebody as a tutor. And I happened to have in my group, I think 6 or 8, but Henry was one of them, and I took a great liking to him and interest and his intelligence. He went on to, from that year, went on to medical school, and unfortunately, a couple of years later, he came down with tuberculosis. After being let out of the hospital with tuberculosis, he came back here to recuperate and looked on what was going on here, and I said, well, hang around for a while. And he did, and that was 30 years of hanging around. His interest in physical activity led him to all kinds of things, including a study of bed rest, and eventually, of course, taking the opportunity of working with the railroad employees, which has turned out to be a prospective study of 2,571 men. I know these figures by heart.
You're working on them every day.
Yes, and they were a remarkable group for these purposes, because railroad employees in those categories tend to stay on the job. If they lose, they lose a lot, so they stay on the job. When they retire, they have a good pension, and when they die, the heirs have a very substantial death benefit. So they're a very good group to study, and Henry and you and quite a few others went along for this job of examining them in quite a number of cities in the northwestern part of the United States.
Yeah, we rode the rails for many years. This is another example of going from the laboratory to the field and back to the laboratory. Henry studied the effect of bed rest, showing that was worse on people than being sick.
Yes.
He demonstrated the principal way to measure work capacity by measuring oxygen during work. And then he took these ideas to the field to determine the long-term effect of habitual physical activity, looking at railroad maintenance men versus clerks versus switchmen. And it was a great adventure for all of us.
Well,
we'll take a little break here.
Oh, yeah.
What about Mount Sinai, Reuben Berman, and our collaborations in that direction that I've maintained since the early days, but those are very rich collaborations. So.
Yes, well, I think that you recall more about that than I.
Paco had a laboratory over there.
Yes.
That was very important. Ernst had work over
yes.
there.
Incidentally, I met Reuben about 2 weeks ago
Good.
at the Med Center place where I go to get checkup.
Good.
And he's very happy, retired, and going strong, but not involved in internal medical care and treatment
Reuben
anymore.
has been a long-term friend of the laboratory. He traveled with you early on in
Yes.
some of your adventures in Italy. He supported our clinical trial units developing over there for the last 20 years, and has been a leading proponent of our work over the years. How do you feel about the name Physiological Hygiene? What did it mean?
Well,
how did it come about? How do you feel about it disappearing?
As you know, I was teaching physiology in the medical school, giving too many lectures for several years, and it seemed to me that there was more to be thought about than simply physiology. It was how it was related to the mode of life and things of that sort. So it occurred to me that there should be a subject which I labeled as Physiological Hygiene. I think it's a good name, and it didn't bother you, did it?
No, it's like Humpty Dumpty, because it means what you say it means. But it was a beautiful name and a beautiful concept because it tied together human biology with health and promotion of health and public health action. And we used epidemiology as a bridge between those.
Yes, that was fairly soon. Of course, it became evident to some of us that through that approach, there was a big opportunity to go after the long-term question of prevention. Right. And although at first the only prevention was coronary heart disease, in general, I think that we would consider, well, what I have been interested in lately, in view of my years, as longevity. And the relationship of these factors of the diet and exercise and and blood characteristics and so on that can be brought out by studies such as went on here and in the field should be material for a program for developing longevity.
Okay, so that's the new physiological hygiene. We survive heart attacks, we survive cancer, and we die at some moment, genetically programmed, and a lifetime of cumulative experience. And you've demonstrated that we can live out to 80, 85, 90, maybe 95.
Well, I've said
very comfortably.
In the manuscript of the paper I'm just writing now on the railroad, I'm saying that let us talk about longevity. What does it mean? I think longevity means, simple meaning is, as you look in the dictionary, I think, it means living a long time. And the measure of that is available to us in these long-time prospective studies could be a target age of 80,
okay,
or even 85.
The proportion of people that live to 80 or
That's
85
right.
in relationship to how much they weighed, their basal metabolism,
all that we couldn't know about them
40 years
before,
ago.
all these other things.
And what do you find?
Well, I think the net result is the most consistent thing that has come from all of the cohorts and all the experiments and so on. The two, outside of age, of course, the two major things, major threats to a long life are cigarette smoking and blood pressure.
And the obesity and the physical activity,
they're
and
much
the individual
less
diet are much less important
Much less
compared
important.
to those things. Okay.
Of course, that I think that in the work that you and your colleagues are doing now, we are seeing much more, going into many more variables than we did look at or could have looked at before. But this question of a target, I'm reminded of various things in the Pasteur Institute.
The Pasteur Institute.
In France.
Yeah.
And the successor to Pasteur was interested in the question of longevity.
Right.
And he went to Greece because he had heard that there were a lot of old people in Greece. And as you know, he came back from Greece with the declaration that the proportion of Greeks was 10 times the proportion of Frenchmen who lived above centenarians. He did make one curious conclusion about that. He thought that the Greeks ate a lot of yogurt, and yogurt was the cure of everything in that regard. As it so happened that nobody believed that, and nobody paid any attention to yogurt until recently. And now, of course, it's all over the world, not necessarily for promoting longevity.
And you found that olive oil probably wasn't bad for you either in that.
Well, that's another thing about, of course, in the studies at Hastings, looking at what items of the diet would have an influence on the blood cholesterol, it was quite clear, I think, that monounsaturated fatty acids,
like olive oil,
which olive oil is a prime example there, have no influence at all on the serum cholesterol. That we should worry about saturated fatty acids, which are from dairy products and meats, on the one hand, and perhaps some of the vegetable oils on the other. I think the question of vegetable oils is being greatly overrated at the present time. And of course, commerce in these questions are all measured in terms of millions of dollars.
The economics, yeah. What role did Finland have in all this great adventure?
Well, it so happened that the first meeting of the Food and Agriculture Organization of the United Nations in Rome, after they moved from the United States to Rome, for reasons I don't know, I was appointed chairman of that meeting having to do with the matter of the diet and health. And at that meeting, one of the young people was Marty Karvonen from Finland. Another was Gino Bergami from Naples, and both of them played an important role in different ways in the future. But Marty told me that coronary heart disease was a tremendous problem in Finland.
In the 50s already?
Yes, already, and they were discovering it, at least at that time. So not too long after, opportunity arose for me to go to Finland, and he and I went together, first to East Finland, Karelia, and there, no question at all that they had a great problem of coronary heart disease. I think I've told you the experience in the
little infirmary in Ilamansa.
The little infirmary.
You'd heard that 50% of them had heart attacks?
That's right.
So tell us the anecdote.
Well, there were only 6 patients there. One of them was dying of tuberculosis. One of them had severe emphysema. A younger man, had been bitten by a bear, and the other 3 had myocardial infarctions.
So the statistics were right, but the implications were
yes.
considerable.
But then on that same time, we went to have a visit to a logging camp near the Russian frontier, only 6 miles from the Russian frontier. And after the sauna, we came out. The loggers had their little refreshment, which happened to be a slab of cheese, half an inch thick, the size of a piece of bread, on which they spread butter and washed it down with beer. Well, I didn't think the beer was all that bad, but the rest of it was astonishing.
The world's worst diet. And then you built an underwater weighing tank down here.
Yes, that was the point there, of course, was the idea that we measured the density of the body weighing underwater. That would give us some indication of how much fat there was in the body.
I never did know how you really decided you could do that.
Well,
the density of bone and muscle.
Well, we were naive. I was naive, and I have in the manuscript that I'm working on right now. I'm pointing out the great error in the assumptions that are made there.
Really?
The assumptions that are made that, of course, that you have really 2 parts of the body, the bone and everything else, and these are a constant density.
And that's not true. Well, there's what's left of the tank, and there are the hooks that the scales were hung on for the in-air weighing. Then we'd pull a switch and dunk them for about 8 seconds, and you'd weigh them underwater.
Oh, a little more than that. We had to do washout of the lungs.
But you didn't do that while they were underwater, the washout. You did that while they were above water.
Just as they came out.
As they came out, yeah. Anyway, this is where it all began, and that must have been when? 42, something like that.
Oh, about that time. I can't say for sure, but certainly no later than 42.
This was the main treadmill room where you had exercise and oxygen consumption. This was a minor treadmill room that they now call the Black Hole of Calcutta. You had a Van Slyke room where you did blood gases.
Blood gases. I think very few of those methods we used in those days are extant anymore.
That's true. Then you had the ballistocardiogram that Henry Taylor did here, and the electrocardiogram, and that's certainly not extant anymore, the ballisto. So this was the center of activities, and the men would come here, and we would examine them for many hours in a very rigid schedule. Mm-hmm. And then the reception was right here on this landing, and the chemistry and X-ray. And you had the Röntgen chymogram in this room. Measured the stability of the heart and contraction with X-ray technique. This was a Faraday cage. This was wired off. Completely electrical screened cage for some of our Simon's work, and it was a refrigerator for a while. Also,
I don't remember that.
And here you had the chemistry lab.
Yes, the chemistry lab.
This was Joe Anderson's hangout, and now it's the Minnesota ECG Coding Center. But the bench was right down the center. And that's where you did all the field cholesterol.
Lot of chemistry, of course, in those days, and using methods that are much more cumbersome, were more cumbersome than I'm being used now.
But you mailed the serum back on filter paper.
Oh,
hung it out to dry.
From Italy, yes.
From Italy, yeah.
Our first trial of the carrying out a prospective study in the field. We had, Joe Anderson and I had come to the conclusion that it would be possible to measure cholesterol on filter paper because once dried, it's quite stable, serum cholesterol.
And then you found out something about flies landing on the filter paper.
Well, the one trouble that Nakata was, this is the fall of the year, September, and there were a lot of flies, and where we had to work was not screened. So first thing we knew, there were fly specks on the toilet paper.
Fly specks.
Fly specks on the toilet paper.
I won't ask what those are, but that's all right.
And well, this is a deposit from the fly, you know, the excreta of the fly. And those fly specks turned out, as we found, we've never published it, we should. They contain something that reacts as cholesterol.
So you're getting false.
So we're getting false high values when there were high.
How did you solve a problem like that? Hire a little boy to brush away the fly?
No, we put in the screens.
You put in screens.
And that was.
Anyway, this is where all that was studied.
Yeah. But that was a very curious experience.
Then we developed the Minnesota Code to compare populations, and now those are still being coded here. Oh, we ought to go back to the dining room just for the sake of old time. This is where we usually had tea when we were a small group. The kitchen?
Later on, yes.
The kitchen hasn't changed much, even in color. Isn't that ghastly? That sickly mustard yellow. Just like the old days.
Yeah.
And the teapot was down there, and people would bring in their own cakes and cookies. And we could all sit around this table, the whole laboratory staff.